Good afternoon. This is Friday, April 24th. Want to thank all of you for joining us on the call this afternoon. We hope that you're all well and taking steps to be safe during this time of continued public health crisis and economic disruption. Today, we're very, very pleased to have Senator Charles Grassley join us to share some information about his activities during this time. At the conclusion of Senator Grassley's comments and participation, we'll have some updates from Jamie Cashman and Lucas Benkin. But before we get started with Senator Grassley, I just want to make sure that you're aware that we'll be recording this call today, and it will be up on the ISAC website later on today. You can find also there recordings of our previous calls for the last 2 weeks. And in addition to information on these calls, we have on our COVID-19 site many other resources that we have gathered from our federal and state partners that we've tried to put in a format that is easy for you to use. Also, we've established a new Basecamp site in the last week and a half that would allow you to get updates on specific information that you're interested in related to COVID-19 and the response. Finally, I just want to let you know that all the participants on the call are on mute, and after Senator Grassley makes his comments, we will be providing him some questions that members have submitted in advance. But if you have questions during the presentation today by Senator Grassley, you can email them to rbennett@iowacounties.org, and she will make sure that I have those questions to either ask today. If we're unable to get answers to those questions today, we will follow up with Senator Grassley and his staff to get answers for you in the next few days. So with that, let's get started. First of all, I just want to thank you, Senator Grassley, for joining us today. I want to particularly thank you for your years of service to the state of Iowa and to our nation. Senator, I'll now turn it over to you, and you can make some comments, and then I'll have some follow-up questions. Thanks a lot for being here.
I think I'll leave the subject matter of the issues to you and your questions, and just kind of give you a process approach here. First of all, to thank you for having a telephone conference call with your members. And this is the way for the last 3 weeks and 6 days I've been doing business from my farm at New Hartford. 6 or 7 meetings like this a day. And that's kind of the way it is for today. This is the 4th call today so far, and it's not the best way to do business because it's better when I can meet you in my office, 135 Hart Building in Washington, D.C. At least your leadership comes and talks over the issues that we're probably going to discuss today. So that office building in Washington is basically shut down. Everybody on my staff's working from home, and so you can contact me the same way, the same phone number you'd normally do, and that stuff's all forwarded. And maybe email's even a better way to contact me for both your opinions on things or problems you want me to look into. The Iowa offices are open, but probably only half on a rotating basis working in the office, the others remote. And as an example of how I keep in touch with my staff, when I'm done with you at 12:30, I will have a conference call with the people we call our legislative correspondents to go over all the mail that's coming in. And our email today I get a report every morning, has run about 1,100, a little over 1,100. One day this week was 1,700, and one day this week it was under 1,000. So we're trying to get all of our mail out as fast as we can. It's a little bit behind now according to our usual standards, but we'll get caught up and keep in touch with my constituents that way, as well as what we're doing today. As far as the financial help of phase 1, 2, 3, and 3.5 that we've had the bills signed by the president, 3.5 was signed today, an hour ago. Most of my involvement with that and rural Iowa was involved with rural health care, but also to keep small business going through the small business loan program, try to get some money out to people that are unemployed through increased unemployment benefits, and of course to 170 million people that got the $1,200 check that went out. When we put all these programs together 3 weeks ago, now maybe 4 weeks ago, it was with the idea that we hoped the economy would turn around in 3 months and we wouldn't have to do anything else, but we went into it with our eyes open, and probably within 6 weeks we'll be making that analysis, and maybe we'll have to do everything all over again. But I think for my part, I want to wait 3 or 4 weeks to make that decision, but just we could be surprised by things, just like we were surprised about the small business loan program running out of money by April the 17th, I guess it was. And so another big chunk of money goes into that. And for those of you that are fiscal conservatives and wonder how Congress throws around money like we're throwing around now, all I can say is that this is the first time in the 240-year history of our country that governments, federal, state, and local, have shut down the economy. And it seems to me we have the responsibility to get the economy up and running again. And that's the motive behind it. For those of you that have county hospitals, we've been for 3 weeks trying to get like for me in Iowa, I go visit a lot of hospitals from time to time for my county meetings. When I go into a rural hospital in Iowa, I don't know whether it's a critical access hospital nonprofit or critical access hospital county owned. But we were until today we were getting trouble getting help to county owned hospitals, and so the Secretary of Treasury put out a ruling this morning that as long as less than 50% of the money to that hospital comes from something other than state and local tax money, that you'll be able to participate in the PPP program, the one that allows small business loan program, so you can keep your people employed at the hospital. Now I'm ready for questions on any subject.
Okay, thank you, Senator. So I just want to make sure I understand that last point on the hospitals. So if less than 50% of their revenue comes from public sources, then they would be eligible to apply for the PPP protection that's part of the Small Business Administration.
Yeah, my staff gave me a summary of it. I haven't read it, but that's their understanding of it, and that's what they communicated to me.
Okay, thank you very much. That's good information, I think, for our members to know. Obviously,
we can send you a summary. We'll send you a summary to follow up that you can distribute.
Okay, thank you very much. So, Senator, you did mention that most of the, so as you mentioned, Congress passed the first 3, and then as the president just signed 3.5 a little while ago. So are there other aspects besides the hospital component that you worked on and that you feel are important for Iowa to know about those 3 packages? Would you want to make any other comments on those that are really critical?
Yeah, we came up with a increase of $600 for the next 4 months in unemployment. That was out of my committee. We changed some tax laws on a temporary basis that will work just for 2020 to establish more capital retention by corporations. This is kind of fallen in the category of helping companies of more than 500 employees, but to some extent it might help companies less than 500 employees. For instance, if you don't have to pay your payroll tax through this year, and you'll have 21 and 22 to catch up on that. Another thing was net operating loss. That was done away with in the 2017 tax bill. It'll allow companies that couldn't take advantage of net operating loss to go back and recapture that money for the 1 year of 2020. Let's see, things of that. Oh yeah, then the other one would have been the $1,200, or for a couple $2,400 and $500 for kids. That came out of my committee as well.
So, Senator, I know that one of the questions that we've previously had about those dollars going back to the taxpayers directly, the $1,200 or $2,400. Do you know how? And we haven't been able to get an answer to this. So there are individuals that may not have a permanent address, or might be homeless, or might not be on the normally paying tax. How are those individuals? How are resources getting to those individuals? Did your committee work on that at all, sir?
Yeah, Treasury took care of that, or IRS took care of it this way, that there's a website you can go through and you can explain who you are, why you didn't file, because it's one of two things. Either you didn't file taxes or you weren't on Social Security, for people that fall into that category. All you got to do is get a IRS number, and they'll assign you an IRS number, and then you'll get, and if you want deposit, it'll be directly deposited. And if you need to get it by check, it'll probably be a little longer getting it, but you should get it based upon doing nothing more than getting an IRS number.
Okay, thank you. Senator, you might be aware that our association, in conjunction with the National Association of Counties, has been talking to the President in Congress about making aid directly available to counties and cities instead of having the funds go through the state. I know that maybe 3.5 was held up as there were negotiations about whether or not cities and counties would be able to get resources to cover lost revenues. I was wondering if you could share your thinking about whether or not, I suppose states and local governments should be able to get resources from the federal government to make up for lost revenues.
Let me answer your question 2 or 3 different ways, and I don't say this that there's conflict between the 2 or 3 different ways. One, the first question, the need for it. I think that'll be determined in the next month, and probably from what I'm hearing, there's a real feeling that there's going to be a need for it, but there hasn't been a decision to do that. In fact, our leader, Senator McConnell, said that we've already put $2.7 trillion of borrowing out there. We need to take a pause and see what the needs are and how much further we should go into debt to do more. So, but on the other hand, you got Schumer and Pelosi and the president saying we're going to have more. So that kind of tells me we're going to have more. How much more? I don't know. And then you get to a further question. If there's going to be more, is it going to go to the states and just cities over 500 million people, 500,000 people, I mean, like we did in phase 3, or whether it ought to go directly to cities generally? And maybe that thought just automatically includes counties, but I don't want to say that there's, it's, when you talk about local government, there's more talk about cities than there is counties. Now, that isn't, that doesn't mean counties are being left out. That's just kind of the way you talk. So then if we have a phase 4 and there's state and local revenue, and I got reason to think there's going to be, how is it going to be divided up? I don't know. So something you could help me now for Iowa counties would be this. I don't know what percentage of your money that comes in from property tax, but I assume that that part of your income isn't going to be affected. It's other incomes you have that would be affected why you need help, right? Would that be fair to say?
Yes. So, sir, about 50%, so slightly less than 50% of the average county's revenue comes from property tax. The remainder of that would come, there would be a fair amount that would come from, say, the road use tax fund in Iowa, or maybe even some federal highway dollars that might come down. But there's also sales tax, hotel motel tax. Those would be probably the ones that would show the most immediate impact. And so we are putting together, we do have a survey out to our members to gather that sort of information, and we'll be working with the state of Iowa and the State Department of Management and Revenue to come up with what the financial estimates. But I could tell you, for example, in one county that we've talked with, they had about $160,000 of expenditures related to COVID-19. So this is one of our top 10 larger counties, out in Potawatomi County. So they had calculated they'd spent about $160,000 in COVID-related expenses, but they're losing because the casinos in their county are closed. They're losing between $150 and $170,000 per month. Yeah. So those are some pretty significant revenue shortfalls. The Department of Transportation earlier this week issued a notice that counties and cities could probably be anticipating that in the coming months they'll see probably a 40% reduction in their share of the state road use tax fund. So we are attempting to put together some information on that, and we're actually hoping that sometime in a couple of weeks that we could arrange a call with you and other members of Iowa's congressional delegation to do a presentation on exactly what those fiscal impacts would be, so that when I got time to maybe consider another phase of activity, that you would have some actual numbers that you could look at to see what the impact is.
It would be a fair assumption on my part that with 99 counties in Iowa, we would provide 99 different sums of money to 99 different counties.
There was a proposal by Congresswoman Axney that I don't know if it's has been introduced as a bill, but it was a sum of money that would have been based upon population by counties, and would have, I think, been distributed by population. So it would have come through the Treasury Department, and I'm not, I don't know if that's the best approach, or if you would you could maybe use revenues for cities and counties, but there was a direct allocation that would have gone to each of the cities and counties across the country. So yeah, it wouldn't be the same amount. I think if we have our members trying to keep track of what their expenditures are and make sure that they understand what their revenue losses are. So it could be maybe on a as-need basis, depending upon their individual circumstance. But we do expect to have some significant shortfalls.
Well, we would look forward to that information.
So I guess one of the other questions, I know this is pretty important in Iowa, obviously, with our ag sector, have been facing challenges for the last couple of years, but currently the livestock producers are facing challenges with the number of meat packing facilities that are running into challenges. Have you been working on anything specific in that area, Senator, that you'd like to share with our members about?
Yeah. Well, first of all, getting the $19 billion that was in the CARES Act to the Commodity Credit Corporation, getting that out as fast as we can. So I've had 2 conversations with Secretary Perdue on it. When's the money going out? And you get answers like this. And I don't say these things to make Secretary Perdue look bad, because I think he wants to get it out faster. But he said it might take us till June the 1st. He's going to try to get it done before. So he talks about for the new programs, like for livestock, you got to write the regulations. You got to get the regulations approved. You got to get the software in place. So then I talked to the president and the vice president about all these red tape problems, but don't really have an answer on how far along we are on that. But we want to get that $19 billion out. Then the other thing is talking to Vice President Pence, because he's in charge of the president's pandemic council task force, getting test kits out so you can test people at the packing plants sooner, keep them going as fast as you can. Or another conversation with me and about 10 other senators with Secretary Perdue, because CDC, the Center for Disease Control, was going to put out some guidance for the Smithfield plant in Sioux Falls that probably would have made it impossible for that plant to work up. And we wanted to express that concern to him, that maybe we couldn't get it up and running. And he tried to say he had good news for us, that he thought common sense was going to be used. But you can imagine when somebody comes along with guidance which has the effective law to maybe open up a plant or make it practically impossible to open up, then that's a concern. So we have those battles going on. And then if you have to euthanize hogs, it becomes an environmental problem. So trying to work with the environmental issues for that, if that becomes a big issue, and hopefully it doesn't become a big issue. But I've heard of some euthanizing of hogs. And so I kind of email the vice president something along the lines of this. Some people are calculating we're about 100,000 hogs a day that maybe ought to be killed and aren't killed. So if you do that for 10 days, have you thought about kind of a question I'm putting out to the president or vice president, and not to be rhetorical, because this could really happen. Then you got 1 million hogs. What are you going to do with 1 million hogs if you have to kill them and they aren't going to be slaughtered, and things of that nature? And then issues I had with about 25 Iowans, probably more involved in agriculture than a lot of our 88,000 family farmers in Iowa, complaining to me about we've got a cap on the amount of money that can go to one farm. And I had talked to the agriculture committee or the secretary about that, and they said, well, if you don't have a cap, you're not going to get money out to every farmer. So there's a case of equity involved in that as well. And quite frankly, I think we ought to maintain the caps that we have, because I've been an advocate for that for the last 25 years. So those are some examples of some of the involvement I've had.
Well, Senator, I see that we're coming up close to 12:30, and we want to be, conscious of your time. Senator, have you ever seen anything like this situation we're in before? This is really new territory, isn't it?
Absolutely. And you've heard me say, it's the first time the government's ever shut down the economy. They've done a lot of things in wartime to redirect the economy towards a national security interest, but this you had to shut the economy down to hopefully get the national health issues under control. But with 521 new cases in Iowa today, they may be getting them under control in New York City, Detroit, New Orleans, but you wonder whether we're getting them under control here. The 2 previous days was less than 100, as an example.
Well, I noticed that I religiously watch Governor Reynolds' press conference every day, and she was on a call with us last week. And tough time to be a leader in her shoes and to have to make decisions on a day-to-day basis that impact all of us. But it does seem like we're still headed uphill on our peak in Iowa. Do you have any thoughts about how soon we should be reopening, or do you want to leave that to the other folks?
She's going to announce that on Monday, but it should follow what the scientists and what the healthcare people say. And I don't think we should be doing what the governor of Georgia did, and tattoos and massages and all that opening up right now. We're going to have to do this cautiously. And she's going to announce it, but she did announce today that she's going to allow some hospitals to resume elective surgery.
And farmers markets too, I believe.
I didn't hear that, but when I had these telephone calls when I normally watch her, so
Okay.
My wife was watching, and I'll see what my wife says. But if you tell her, if she says farmers markets, then farmers markets are opening up. You ought to be able to maintain space at a farmer's market.
Okay. Well, Senator, I think our time is up with you, and I just really appreciate you joining us today. And again, I want to thank you for all the work you do for all of us here in Iowa. And can you please be safe and take care of yourself?
Yeah, thank you very much. Goodbye, and tell your people we're still available by phone or by email. Everybody's working hard, but just from a different location.
Okay, we definitely will. Thank you very much, Senator.
Okay, goodbye.
Okay, so now, again, it was great to hear from Senator Grassley and some of the things that he's been thinking about during this time period and the things that he's been working on. But we want to just take a few minutes and have a couple of updates from some of the ISAC staff members. And I want to start out with Jamie Cashman, our Government Relations Director. So Jamie, are you on the line now?
Yes, I am. And thank you, Bill. Certainly what the Government Relations team, as well as the entire ISAC team, has been working on is the continuous monitoring of what's happening on a state and federal level in response to COVID-19. I'll try to be brief. I know all of your folks' time is very precious, and so probably the most immediate thing that will be coming up will be that the governor's current emergency proclamation expires next Thursday, April 30th. And what we expect that there will be a number of announcements, as Senator Grassley and as Bill talked about before, that the governor made some announcements today that will be coming out following her press conference today on farmers markets and also on hospitals, on elective surgeries, and we're expecting there'll be a number of other announcements next week with that upcoming deadline on Thursday. And so I know there's a number of affiliates that are following a number of different issues, whether it's the county auditors in regard to public places for polling sites that they're waiting to hear back from the governor on. And I know our treasurers are waiting to hear back on a number of different issues in regard to the suspension of property tax interest and payments, and also in regard to the tax sale. So what we will continue to do, our full team will be putting out updates as this information becomes available. Also, we're expecting that the current suspension of the Iowa General Assembly, well, its current suspension also goes through the end of April, that will be extended to sometime in May. So what that date will be, that remains to be seen. I think it's a real big moving target, as what we have heard from legislators is that when they do convene, they will only focus on priority policy bills and formulating the state budget. And so obviously to try to get the biggest handle on what those revenue losses will be as a result of that continues, like I said, to be a moving target. And so to kind of follow up on that, as Bill had mentioned before on the call, that we have put out a survey to all of our members, and we're strongly encouraging members to fill that out to give us a greater sense of a couple of different things. One, expenses incurred in combating COVID-19 so far, so that we can tap into the additional or the existing federal funding that has been appropriated to the state. And following up on that, I know we've received a lot of questions in regard to the CARES Act and how that will be distributed. We've been waiting on that for a couple of weeks now, and just the rules from Treasury came down today, or not today, sorry, a couple days ago. And so as this becomes apparent through the state, we'll be providing additional guidance out to all of you in terms of how that money will be distributed. Second, one of the biggest components of the survey involves the expected losses in revenue. And basically that's to address the next round of funding that we talked about in the federal call with Senator Grassley. And so the sooner we can begin to somewhat quantify, I know it's always going to be a moving target, but to kind of put those facts and figures together so we can be advocating, on a federal side, and to continue to encourage that any additional federal aid would come directly to counties is something that we'll continue to fight for. And so just lastly, I have, so what we're looking to do as we've done, so we had a call with our federal officials a couple of weeks ago. We had a state update call last week, and then another federal update today with Senator Grassley. What we're looking to do is set up another state update call, looking at probably sometime next Friday to get the latest from the various different departments, state departments out there, and hopefully to get the latest update in terms of how the federal funding will be distributed out to counties. So with that, I will turn it over to Lucas.
Lucas, are you still here? You probably have to unmute yourself.
Good afternoon. Yes, I'm unmuting both my phone and the app. Glad to join you. As I was looking at my list of things to address, I think Jamie pretty much covered all of them, but I would just reiterate the importance of filling out that survey that went out on Tuesday as we continue our work to gather not only increased expenditures, but decreased revenues that counties are facing so that we can make our case to our federal delegation and the White House for the next round of aid that might be coming. And the only other thing that I would add is, as Jamie mentioned, we're expecting more proclamations and extensions of the original proclamation from the governor. There should be one coming out here within the hour, and then we're expecting another one on Monday. And ISAC will be putting out an update probably Monday with an update on that, as well as all the other things that we're working on. So continue to monitor your email. I'm sure if your inbox is like mine, there's just a ton coming in, more than usual. But we continue to try and keep you updated. So keep an eye out for messages from ISAC. And as always, if you have any questions or concerns, you can reach us at any time.
Thank you, Lucas and Jamie. Appreciate those updates. So before we close the call, there's just a couple of final things that I want to mention to you. First of all, as I said at the beginning of the call, this call with Senator Grassley and staff has been recorded, and it should be available on our website later today or no later than Monday morning. If you had any questions that came up after anyone has spoken today, or you had a question that didn't get answers, please feel free to submit those questions to rbennett@iowacounties.org, and we will do our best to track down an answer for you over the next couple of days. I also want to mention that we have been working very closely, as I mentioned earlier, with the National Association of Counties to make the case to Congress and the President about making sure that counties and cities that will be facing revenue shortfalls in the near future, that Congress and the President give consideration to helping with those revenue shortfalls. As I indicated earlier, we're starting to get some information trickling in from our members about what their challenges are over the next few months. And with that, finally, again, I just want to thank all of you for the job that you're doing every day. I know this is very difficult times for everyone, that this whole pandemic issue and the financial challenges that we're facing really has not been something that we have experienced for many decades. So please let us know if there's anything we can do to assist you or to get information for you. And again, keep up the good work and please be safe. Thank you very much, and we'll close the call now.